Hi everyone, I'm Ems. About 18 months ago, I've done a chin filler to enhance my chin. Until now, you can see the results of my past procedure. And today I'm back and I'll do my nose enhancement. Actually, my nose is one of my insecurities because as a Filipino, we really have like a bulbous, rounded nose lift. So now I'll do my nose enhancement with Dr. Contessa.
Hey everyone, I'm Joy Bondok from Angeles City and welcome to CSA. Today I'm about to take you along with me with my personal experience of beauty enhancements in a non-surgical procedures way. So if you have watched my previous videos, I've done old therapy, chin fillers, some jawline redefining, and nose lift. And months have passed, everything still looks so natural and no one could tell I've done this procedure unless I mention it. Which I think speaks volumes on how well Dr. Contessa can naturally enhance your look without changing your entire appearance. And right now, I'm getting my lip fillers, which I think is a good option for you to enhance your lips, add volume to your lips, and Doc Contessa is the one and only that can reshape your lips in a natural way, and that's exactly why we're here. Don't forget to hit the like and subscribe button and ring the notification bell for updates.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a follow-up from our two beautiful ladies here who are working together. Okay, so Miss Joy and Miss Ems. So how are you, girls?
Feeling pretty.
Feeling prettier, more confident.
Yes.
Because in CSA, we have a tagline like it's empowering and enriching, right? So Joy had before a treatment called V-Contour and we were able to achieve that. And at the same time, we also worked on her nose with a big impact, right?
Yes.
Kind of like the nose projection really balanced everything and beautified everything. And Miss Ems also kind of the V-Contour with the chin enhancement and getting rid of the submental bulge there. Right, there you go. And I'm so happy with these girls because kind of like in their lives right now, there are new things happening, right?
Yes.
So Joy is now working in an aesthetic center. Ems is happy, happy, in love, in love. Okay. So in every treatments that we do, okay, these are enhancements. We highlight the beautiful features of your face. It's not altering your looks, it's not modifying your anatomy, but it is just bringing out the best in you, right? So for today, we still have a treatment that will further enhance. For Joy, we want to work on her lip area, okay? So this is just like more of lip contour, okay, and hydrate the lips. She's still young. It's not an anti-aging treatment, okay? It's like hydrating the lips and maintaining that good lip contour and also balancing it because if you look at the lips, there's some asymmetry, okay? It's not perfectly balanced left and right. You'll notice some difference, right? Do you notice that?
Yes, Doc. Pag nag-smile po ako, yung isa nakataas.
Right, there you go. So there is this so-called asymmetry of the right and the left. And also with our beautiful Ma'am Ems here. So we did the chin projection. If we check the Ricketts E-line, we will just want to balance the Ricketts E-line, right? So we will do an enhancement, a natural enhancement of her nose. Actually, her nose is beautiful as an Asian, right?
Yes,
They're saying that the Asian nose is cute nose. Okay, like it's more of the okay, the petite side of people. We are in the tiny people.
Yes.
Okay. That's why we have also like a small nose, or they call it like yeah, Filipino round nose thing. Okay, there's a term there. I think forgotten the term. Not that bulbous, not so much, not that very kind of super wide, but just the right one. And we want to just enhance, follow those angles, the nasofrontal, the nasolabial. We'll just make it within the proportions, and we'll beautify further the face. We'll show the procedures when CSA Medical Aesthetics returns. And we're back. So we're here with Ma'am Joy, and we're working on her lips right now. So I was assessing her lips a while ago, and there's a noticeable asymmetry. Kind of like the left side is narrower as compared to the right side there, and you'll notice some cracks on the lips, right? And it seems like the lips are dehydrated, so we need to rehydrate with our hyaluronic dermal filler. I use the so-called Vaseline Kiss. So I'll be starting on the lip borders. Okay, we'll be working on starting on the philtrum point here, the GK point. So the part of the philtral column there, the right side first. I'm just gonna pinch this one, Joy, okay? Inhale, exhale, and a tiny prick there, just to emphasize the so-called GK point. Same thing on the other side there, just a little bit there, okay? So this is a needle method. Sometimes I use a so-called cannula method. And then I'll work on the lower lip area. Before I work on the upper lip, I start with the lower lip. I'll make this so-called tubercle. So I'll start with the right side here, pinch the right side, and then insert, and I will still do an aspiration there, okay, just to make sure I'm not in a blood vessel, and then I'll deliver like a 0.1 here. So this is to create that so-called tubercle or cherry lips, like delivering a 0.1 there. And then let's go to the other side. So same thing here, just a linear method here, or kind of like a linear retrograde, and we'll deliver also a 0.1 here. Okay, so since we have an asymmetry, we also want to correct that asymmetry. I'm just gonna go back a little bit again to create that tubercle. Okay, so I've done the lower. So there's an instant creation of the so-called keyhole already. Let me just continue on working with the borders here. The vermilion border there. Just a little bit, a minimal amount on this side. And then we'll go on the lower vermilion border. Doing the lips, we have different techniques. You've been hearing about tenting techniques, fencing technique, lollipop technique. So it depends on your kind of lip that you want to deliver. So we have done the lip enhancement for Miss Joy. Let's proceed to her friend, Miss Ems, for the non-surgical nose enhancement. And we're back. So it's now the turn of Miss Ems. Okay, as usual, we'll start with the so-called numbing of the tip of the nose. So we'll just pinch the nose area here, and I have a lidocaine solution here, and this is the one that we're gonna inject with our lidocaine. There you go, just a small amount. And then we have an entry point here, and we'll just have an OS there, and then the entry point center of the philtrum there, and I'll make a tiny prick of the tip defining point, and this is my lidocaine with the filler. Okay, so I'll just inject into the layer 4 of the nose. You're still good, Ems?
Yes,
okay.
no.
Just pull up and glide. Reaching the radix part. Okay, radix part there is there. Okay, we're good. So we can now push our filler with lidocaine. Okay. So this is made up of your hyaluronic substance, and the good thing with this, it will give volume to our nose. So when I do the radix, I give a minimal dose of this, just a minimum amount. And then we'll also work on the tip columella. Glide it there up to the anterior nasal spine, and I'll just give a bolus injection of the hyaluronic substance there. And then we'll go with our threads, PDO threads again. We'll insert this polydioxanone thread. Okay, so I'll pull out. So again, deliver my PDO polydioxanone. Okay. And the third one, the fourth one, and the fifth one. So the number of threads will really depend on the height, needed height. Sixth one. And final one. And then let's do the tip columella with our short threads. Okay, there you go. So we have short threads. So I'll use the same entry point. We'll just prick it a little bit there, directing it into the anterior nasal spine. Okay, we'll just pinch, and this is a 1938, so we delivered it into the anterior nasal spine. We want the tip projection, and the final one, so we use a total of 10.
Yes.
Okay, so we've done the nose enhancement for Ems. We'll show the result when we return. And we're back. So we have done the non-surgical enhancements for our two beautiful ladies here. So let's show the result to them. So first, Ems. She was the last one we have done nose enhancement. So the elevation of the radix and the tip columella. So we have improved the nasofrontal as well as the nasolabial angle in a kind of how many minutes only. It is an instant result. Instant beautification, instant enhancement of the nose. And I did a check of the rickets E line. It's also balanced within the line. And wow, overall, she's so pretty. Yeah. And Joy here, from like the very thin lips to fuller lips.
Yes, full lips.
Still natural, but we created some of that shape, the supple cherry lips. We also emphasize the tubercles of the upper and the lower lip. So right now, it's really that well-projected lip, volumized, well-contoured, and yes, sexy lips. Okay, but still natural. I think that's the trend right now for young ones. They want the Kylie Jenner lip type. Kind of like you also speak through your lips. You kind of like bring out the beauty of the lips there, but still the natural way. Okay, we want it within the right proportions, the right symmetry, and it's like balancing with the upper third, the middle third, the lower third, and then the lower third, the 1:2 ratio there. We want that good balance, the ratio of the upper and the lower lip, like around 0.8 to 1 ratio. Like we want the upper lip projected and the lower lip thicker or more volumized than the upper. Okay, but there are like case-to-case basis, they want like a 50-50 ratio. Okay, but cute when you have the 0.8 to 1 ratio. Okay, girls, how was it? So, Joy?
Still, parang may tight feeling pa po siya sa lips. But, yung pong, the whole process is totally manageable and I barely remember the discomfort.
Right.
And the result is very worth it, though.
Yeah, instant
Quick
result
and
again.
easy.
Correct. Yeah. Made you more confident. You don't look like the old Joy that I have met, right? With all that we've done, the V-contour, the nose enhancement, the lip enhancement. Wow.
Very different na po,
Very
no?
big impact. Prove the profile of the face. And Miss Ems.
It's not painful at all, Doc.
Right, yeah?
Yes, Doc. Like, after the procedure, a little pressure.
Pressure, correct.
But tolerable.
Tolerable
Yes,
overall. Worth it?
Very, Doc.
At first, you kind of like, at first, you were hesitant
Doc.
because it might change your look or
Doc.
your parent or your loved one
Doc.
will kind of not approve, but I think they will approve of it right now. Okay, there you go. Thank you so much.
Thank you, Doc.
Yeah, I'm so glad that you are both like, very happy with the
Yes.
outcome, very satisfied with the outcome.
Yes,
Okay.
Doc.
So if you have any questions, you may email us at csaskinclinic@yahoo.com, our FB page, CSA Medical Aesthetics, Instagram, CSA Medical Aesthetics. Our clinic is located here at the Infinity Shop, Pulong Marugol, Angeles City. Contact number 0933-860-9193 or 0917504428. Do you have any social media that they can follow you?
You can also follow me on Instagram, Joy to Your World, and Miss Ems.
You can follow me to my Instagram, Ems Manalo.
Yeah, and they had their previous episodes. Just look at our YouTube channel, Contessa Salvador. Please do subscribe and also click the notification bell and all of those stuff, okay? So thank you so much. God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetic.